Joining me live is Sean Rooney, CEO of Leading Aged Care Services. Thanks so much for your time. So we've just learned there that 25,000 residents in aged care centres in Victoria have been vaccinated. Would you have any idea what percentage of that is of the total number of aged care residents in that state?
Look, I don't have that numbers at my disposal, Laura. What I do know is that as of yesterday, every aged care home in Victoria has had their residents offered the first dose, and in some cases, as reported just now, some of those residents have had received their second dose of the Pfizer vaccination.
Okay, but offered and getting it, as we know, are two very different things. And we heard the caveats there about, sickness and some hesitancy from aged care residents. Do you think 25,000 would be an adequate number? And these figures that we keep on getting about the number of services, it doesn't really mean much. We need the numbers when it comes to actual residents, don't we?
Well, look, the first thing to note is that people have to provide informed consent to receive a vaccination. And there's quite a process that needs to go through to make sure that older Australians in care are adequately briefed or their guardians and family members are adequately informed so those decisions can be made. And for some health reasons and for some other reasons, people decline the vaccine. I've got to say what I'm hearing in most cases, it's 90% or more residents are quite happy to be vaccinated. But I think getting back to your point about the numbers, what we saw was the government set the expectation early on that from mid-February, all aged care residents and staff were priority 1A in a vaccine program that was to conclude by the end of March. We're now here at the 1st of June. We still don't have every aged care resident being offered that vaccine, and the aged care staff vaccine rollout is confused and frustrating at best.
It's really frustrating. So where are we at? I mean, I can't get a handle on the numbers here from estimates and, picking together parts of information that we're being given publicly. I can see that maybe 10% of staff have been vaccinated, but we're still not sure. Can you shed any light on that?
Well, what I can tell you is we've been in constant discussion with letters to ministers. We've convened industry roundtables with bureaucrats and experts. We've put forward any number of recommendations and suggestions around how to vaccinate aged care workers efficiently and effectively, and the government has decided not to take that into account and has put in place, as I said, a program that has stopped and changed. It's been confusing and frustrating. And even as recently as several weeks ago, we asked them the very question you've asked. Well, tell us how many people in aged care staff have been vaccinated, and they can't tell us. Now, at the aged care home site... Can they not
tell you, Mr Rooney, or do you think they're choosing not to tell you?
Well, look, I take it on face value. What I do know is that anybody immunised in the country has that immunisation recorded in the Australian Immunisation Register. Now, in that register, there is no field to record if you're an aged care worker or an aged care resident, so they can't access a national database. We know that it's a requirement for aged care homes to record the immunisations for their residents and their staff. So the information is there, but there's no process currently in place, notwithstanding our requests for it, in place for the government to be able to report that at a state level, a site level or a national level. And that's clearly a gap. And we're going back to government. I spoke to ministers yesterday. We're going back to them today with the proposal that the sector put forward, as I said, several months ago, that there should be in-reach teams going into aged care homes. All aged care workers should be offered the Pfizer vaccine. For those staff that aren't on site on the day, there should be a dedicated channel for them at the front of the queue in GP clinics and in state vaccine clinics, and that for all other workers, they need to be assured that they are back at the front of the queue, because that's what we were told, but it's clearly not the case.
Okay, so we're possibly looking at less than 10% of aged care workers being fully vaccinated 14 weeks into the rollout. We're now in our fourth wave in Victoria, and staff are still moving between multiple centres. How concerned are you about that?
Well, first of all, we're very concerned with the situation in Victoria. We've been here before and it fills us with dread. I've got to say that there have been significant lessons learnt from the second wave in Victoria in 2020, which resulted in the CDNA issuing a new guidance for aged care operators with respect to their outbreak management plans. So those plans are now in place. They've been stress tested. There's a lot more focus with infection protection control leadership on site in every facility. So we are better prepared than what we have been. But the missing piece really has been that vaccine program rollout that has been failing to deliver. Now, the single-site arrangements, as ministers have said, they stand them up and stand them down in response to a community outbreak. The challenge we see with that, and we've discussed this previously with the bureaucracy, is that it's very difficult to just switch those things on and off. I mean, if you're an operator with, say, 6 or 7 homes that are caring for 100 people in each home, you've got probably 150 to 200 staff, to within 24 hours say we're going to re-roster all of those staff to ensure they're working only across one site, you can't just turn it on and off. Now, we can only assume that program, the practice of standing up and standing down, that particular program is informed by the medical advice and the scientific advice. But I think that needs to be reviewed if we're really serious about making it the national priority to keep older Australians in care safe and also the people that care for them.
Yep, surely it's about mitigating the risk as well, and that there's no staff on hand to look after these residents. They're worse off, COVID or not. Just one final question. This talk about mandatory vaccines for frontline staff in aged care, a good idea?
Well, look, this is something that we looked at back in January when it became clear the TGA was improving the vaccines. We said, like we have all along, we need to get the official advice from the scientific and medical experts. The AHPPC advised National Cabinet at the time that mandatory vaccinations for aged care workers was not warranted at that point in time, but they could reconsider that decision. And now it's clear that, again, from ministers' discussions yesterday, that the AHPPC are looking at this again and that they will make advice back to the National Cabinet this week. Okay. I've got to say, mandatory vaccinations in aged care, we do that already for seasonal influenza. It's nothing new to be implemented. As long as the medical exemptions are in place, then if it's going to keep people safe, then that's what we should do.
Sean Rooney, thanks for your time.
Thanks, Laura.